Well, if Victoria was a country, this is a fascinating statistic we found out today, it would rank in the top 20 for the worst COVID-affected countries in the world. It's a pretty grim number, isn't it? 1,350 cases of COVID recorded in Victoria in the past 48 hours alone. Victorian Liberal MP for Kew, Tim Smith, says enough's enough. The Victorian government's out of its depth and the state needs urgent commonwealth intervention. Tim Smith joins me now from Melbourne. Well, you're pretty vocal on radio this morning. You certainly woke me up on Sydney Radio. I was having a listen. You say Scott Morrison needs to take over Victoria. What do you want to see happen, Tim?
Good evening, Peter, and good evening to your viewers. What I want to see is Victoria refer its powers with regards to this emergency and emergency management for this pandemic to the Commonwealth. There is precedent for this. Jeff Kennett referred Victoria's industrial relations powers to the federal government in 1996-97. I want to see Victoria's powers referred to Canberra because we have lost confidence in Daniel Andrews. Victorians across the board have lost confidence in his government's ability to manage this pandemic, to manage this crisis, and we want to see this run out of Canberra, run by the Prime Minister, by the Health Minister Greg Hunt, and indeed by the armed services, because whatever has been going on in Victoria clearly has failed, and we need a federal intervention, and we need one now.
I guess the worry for me when you look at it, it's not just the isolated incident of the bouncers at the hotels, the failure in quarantine. It's all the issues with contact tracing. It's now being slow on the issue of aged care when we could all see the vulnerability the aged care sector would face. It's a whole calamity of issues. And the Premier today is saying when they knock on the door that 1 in 4 people who have tested positive for COVID, that they are not home, they're out and about in the community, some are at work, and there's no great consequence for that. Indeed, he sends the army out to get their groceries. I mean, no one really has confidence they can put the genie back in the bottle. One of your federal colleagues, unnamed in the media today, said about all Victoria can do now is start to stockpile ventilators. That makes it feel, for everyone stuck in this mess in Victoria, that governments are giving up on them, Tim.
Well, our language is very important at the moment, and I think a lot of Victorians are at breaking point. I think that a lot of people are very fearful, people are scared, people are angry, and people want to see resolute and strong responses from government that they can fix this mess. And one of the things that I would have thought should be top priority is getting to the people that actually are positive with coronavirus and making sure they have no further contact for 2 weeks with anyone else that doesn't. This government has
do you think that people who test positive, we give them the benefit of the doubt, and if someone knocks on their door and they're not found to be at home, that they then move to a more secure place to serve out their quarantine? What do you think?
Absolutely. I think these people, if they've tested positive and are found not to be at home, should either be fined or put in quarantine at their own expense, whether that's in a hotel or a hospital, given how sick they are. And also possibly the use of ankle bracelets like we do with released criminals, because this is the crux of this issue. We have to make sure that the people that have coronavirus are kept away from everyone else that doesn't. It is that simple. And because the Victorian government has been so appallingly slack with contact tracing, I mean, I heard the New South Wales Chief Health Officer on radio this morning who sound very much on top of her game. Every single new case of coronavirus in New South Wales, they know exactly how everyone contracted the virus. Every single case in New South Wales at the moment, they know exactly how they got it. They can build a ring around those cases. In Victoria, it's Brown's cows. No one has a clue how over 1,000... Raph Epstein, who is no fan of the coalition, made this point on ABC radio earlier this week, that there is at least 1,000 cases in Victoria at the moment where no one in government has the slightest clue how these people contracted the virus. Well, when you add up the fact that people are wandering around Melbourne, going back to work after testing positive with seemingly no consequences, the government has no idea how any of these people contracted the disease. Well, that's actually what I'm scared about. The 700-odd cases, the fact that we're having as many cases as the United Kingdom is a huge worry, obviously. And as you said at the outset, we're in the top 20. Victoria, for country, would be in the top 20 hotspots in the world. What worries me most of all is that they've completely lost control of the virus. They've got no idea where it is. And that's why the whole of the state...
And they're looking now at stage 4 restrictions, it certainly will not be a case that Victoria is out of a stage 3 as it is now in 3 weeks' time. We know what it's doing to the economy. Tim Smith, thank you for your time.
Thank you, Peter.